All right, good afternoon and welcome to our webinar today about learning how to live a more fulfilling life and less pain and discomfort. And so today we're going to be discussing Regenexx, an orthopedic surgery and pain alternative. And it's been very trusted since its inception in 2005. So let's go ahead and get started, and thanks for coming. And I want to wish everyone a happy Valentine's Day. All right, so here in Columbus, Georgia, myself, Dr. Gary Dawson, I attended Tulane University, and following Tulane University for medical school as well as undergraduate, I attended the University of Pittsburgh Medical Center, where I completed my internship, residency, and fellowship. I started practice here in Columbus, Georgia in 2004. And back in 2018, I started doing training sessions, learning about use of biologics and how we treat some of the common pain problems that exist for the spine and peripheral joints, shoulder, knees, hips, elbows, fingers, and ankles and toes back in 2018. Also with me in the practice is Dr. Marzina Buzanowska, and she attended the Wright State University, the Boonshoff School of Medicine, and that's in Ohio. She also did her internship and residency at the University of Pittsburgh Medical Center a few years after me. She subsequently completed her fellowship in interventional spine at the University of Pennsylvania, and she's previously been on faculty at Cleveland Clinic for approximately 4 years before joining us down here in Columbus, Georgia. She completed her interventional orthopedic foundation training in 2022. And so Regenexx, what is it? And so Regenexx was the first company to go ahead and start using biologics, stem cells, as well as platelet-rich plasma, also known as PRP, in treating patients with common musculoskeletal conditions when steroids were no longer effective, as well as the patients wanted to avoid surgery. Regenexx, as we're a part of it, has done the most research regarding use of biologics in the treatment of musculoskeletal conditions, as well as performed as a total group the most interventional procedures related to using platelets, PRP, as well as stem cells in treating musculoskeletal and orthopedic conditions. And yes, it is safe. These procedures are done minimally invasive, usually in procedure or operating room suites under sterile techniques with a minimal chance of risk, although it's not 100%, but there's minimal chance of risk when we do these procedures. And it has been researched. Regenexx has completed and participated in about 44% of the worldwide research in the use of orthobiologics, PRP, as well as stem cells in the use of orthopedic conditions. And so the question is, why are you here today? And some people are here to get information. Some people are currently experiencing pain, and that's causing some inability to achieve the type of lifestyle that they want, to be able to concentrate and participate in outdoor activities. Some people want to simply avoid surgery. Maybe you've had friends or yourself who've had surgery and didn't like the outcome or the pain that you still continually experience despite having undergone some surgical procedure. Maybe you're not a surgical candidate at all. Maybe you're just looking for other options besides taking medications, receiving steroid type of injections, and you don't want to rely on medications. And you just simply want more from life, and you want more from your own life, and you're not ready to slow down yet. And so some obstacles that get in the way when we talk about looking at how do we assist and integrate other treatments in the management of pain, such as stem cells, as well as platelet-rich plasma, is one, financial cost. And the majority of these are not covered by insurance, although there are some insurance companies in which their beneficiaries have these as options for them to explore and utilize. Time, obstacles get time. You don't want to take away or lose time from work. Surgery can cause significant delays in healing time, as well as you getting back into feeling normal or better than you were subsequent to the surgery. And, there's a lot of confusion out there. What's real stem cells? What's PRP? Who's the best option? What types of physicians are the ones you should rely on or trust in order to perform these procedures? And that's created a lot of fear. Fear of the unknown, fear of misinformation, which leads to how can I trust that the person who's going to be performing the procedure has been trained in the proper way to ensure that I achieve the best possible result when I am receiving either my own stem cells or some platelet-rich plasma. And so the goal today is to help you see, Regenexx as an alternative choice in your care. To help you discover, one, if you're a candidate, because not every person that we see is a candidate for this type of therapy that we offer. And then following the discussion, we may be able to assist in helping you schedule an appointment with either us or maybe a Regenexx physician that is closer to you from a proximity standpoint. So let's go over our agenda. What is Regenexx? Going to cover up, current options that you may have tried or currently experience, and then as well as, what is interventional orthopedics and why is Regenexx different than anyone else that you may have currently received via mail, via infomercial, or on the internet for choosing someone trained with this great alternative to orthopedic or surgery as an option for you, and then who is it for, and then results. Just like everyone, we want to know what results because that helps us make an informed decision. So what is Regenexx? Regenexx is, an orthopedic surgery and pain treatment alternative, which what that means is that it's more of an interventional based treatment algorithm where we used your own biologics in a custom fashion, that we get the concentrations that we believe are best in order to achieve some sort of healing, stimulate your natural healing response, or it can help you even to regenerate some damaged or injured tissue. And it's an advanced regenerative medicine procedure, and it's a trusted alternative to orthopedic surgery. Remember that this has been out since 2005. Dr. Centeno Schultz clinic, John Schultz and Chris Centeno, they're the ones who pioneered and started using stem cells in America back in 2005. And it's only grown and advanced in the types of treatments we do, as well as some of the ways that we prepare treatments in order to help you achieve the best result. So currently, you may have experienced some sort of pain, and the treatment options usually are going to be pharmacological, where you use some over-the-counter treatments, Tylenol, maybe some topical anti-inflammatories, Voltaren gel, maybe some oral agents such as naproxen, meloxicam, ibuprofen. And then you have low-dose opioids, and since there's an opioid pandemic, people are kind of shying away from that itself. And then we look at non-surgical treatments, which usually going to be injection-based, where we'll use a steroid to help reduce inflammation, which then alleviates the pain if there is a significant inflammatory component and you feel better. But the problem is the underlying problem has not been addressed or fixed. We're sort of fixing the symptoms in order to help you better manage or cope with your problem. And we do things using hyaluronic acid, which is more of a lubrication ingredient or injection to help reduce friction of joints. We do interventional procedures in the spine where we use steroids to reduce inflammation along nerves. We may inject directly into joints, as well as heat up nerves, what we call cauterization of nerves, to reduce pain that you experience. But like I said before, that is not treating the underlying problem. And some people will go to durable medical equipment such as bracing, using chiropractic care as well as manual physical therapy, acupuncture, yoga, Pilates, and etc. And then that leaves us with surgical options, which typically is to repair, replace joints, or remove missing or injured problems, as well as fusing certain joints to create more of a stability factor. And the current options we see, pharmacological, as I have said, they're all best temporary band-aids, meaning that at some point, depending on your activity level or the scope of the pathology or problem, your condition will likely reoccur and become more inflamed. And some of these medications that we use have some serious side effects. And, other options like a non-surgical, the steroids, the radiofrequency ablations, the spinal cord stimulators, massage therapy, all offer some effective immediate results, but long-term, you don't get significant benefit from those. And then you can look at the long-term side effects of steroids, which can, increase the likelihood of diabetes, increase bone density, leading to thinning of bones or osteopenia or osteoporosis, as well as being a destructive agent for cartilage, which accelerates the rate of arthritis progressing if you have it in significant weight-bearing joints. And, when we look here, surgery, what this slide is indicating is that surgery definitely, for some people, is unavoidable, but, over 50% of patients, it can be a way to avoid surgery. And looking at meniscus surgery for the knees, lumbar discectomies, and infusions of the spine. When we look at tears in the shoulder, some of these types of surgical procedures may be avoided. And surgery without itself does not come without any risk. There's always risk, and it doesn't necessarily always work. You can fix the image, make the bony structure more stable, but the patient still may be experiencing debilitating pain that's interfering with their quality of life and ability to function. And surgery, once it happens, it can't be undone. So one way to look at interventional orthopedics is sort of like cardiology and interventional cardiology. The traditional way of cardiology, especially when repairing patients who had coronary artery disease and needed bypass surgery, was to go ahead and perform an open heart surgical procedure. Over the years, techniques have been developed in which the same sort of benefit can be achieved without major surgery when they're doing interventional cardiology through veins and arteries. And so that's the way we look at interventional orthopedics. Instead of something that's surgical, which requires longer healing times, as well as the potential of it not being effective as far as alleviating pain, that we are using interventional techniques to guide, image guidance, to guide needles into areas that are damaged in order to help facilitate healing. And so there's over 85 potential injections that we do with Regenexx, and if we're doing a stem cell procedure, it's going to involve only the cells that you have manufactured in your body, no one else's. And so when we talk about interventional orthopedics, the majority of physicians in the United States are currently doing simple injections. And these typically are just injections performed within the joint, and they are usually not guided, meaning that they're not using any image guidance to ensure that the needle is placed where it is intended to be placed. 4% of US physicians are using some sort of image guidance to perform simple injections, and then about 1% of US physicians are using interventional orthopedics, in which we can target areas within each joint specifically: tendons, ligaments, joint in the bone, labrums, as well as injections within the femoral head and acetabulum of the hip. When we look at the knee, injecting into tendons, the meniscus tear, the anterior cruciate ligament, as well as posterior cruciate ligament. And we can pinpoint and direct all of these needles with pinpoint precision and accuracy to ensure that we get the injections exactly where the problem is for the patient. So in the shoulder, if it's a ligamentous injury or some instability with your glenohumeral ligaments, or you have a labral problem, or even tears within your rotator cuff muscles, we can effectively guide needles precisely into where you're having those issues to help stimulate, promote healing, and avoid major surgery. And so it's, it's an innovative new option, right? It's an injection-based, non-surgical, and we help stimulate your body's natural healing, as well as in the use of your own stem cells can promote rebuilding of injured tissue or damaged tissue. And how is it different? And so we look at orthobiologics, right? And so orthobiologics are broken down to a few different areas. One, cytokines and growth factors. And so these growth factors exist within platelets. So when we talk about platelet-rich plasma, platelets themselves release growth factors, which sort of like messenger signals to tell your body where it needs to come and focus on help rebuilding or stimulating some sort of injury response. And then we have bone marrow and stem cells. And so stem cells, as well as a bunch of cells, are grown or manufactured within your bone marrow. And so these are your own cells, and these are not from placentas, because placentas may have stem cells when the afterbirth is immediately procured. But in order to sterilize those sorts of things, you have to radiate them. And if you irradiate them, you destroy all the tissue or kill all the living tissue. And so it's a dead tissue product. And we look at extracellular matrix, which is, things that are done from amniotic fluids or extracellular membranes, so like the placentas, and then concentrated platelets, which is platelet-rich plasma. And with Regenexx, we focus on super concentrated platelets because each individual has a customized requirement or concentration of platelets that may improve the likelihood of success based upon type of injury, where the injury is located, whether that's a tendon, joint, as well as the age of the individual. 80% of what we do is platelet-rich plasma, and only about 20% of what we do is stem cell utilized. And so everybody does not require stem cells, and it's a significant cost difference. And so what structures, are we talking about when we're looking at interventional orthopedics or using your own stem cells or platelet-rich plasma? The musculoskeletal system, which includes your joints, your ligaments, your tendons, your meniscus within the spine, the disc within the spine, ligaments, the nerves, as well as bone. And the conditions we treat are, arthritis, tendonitis, torn ligaments, individuals with spine pain from multiple etiologies, as well as disc-related issues, disc bulges, disc herniations, and the meniscus, the cushioning between the knees, in which you have tears, which can accelerate or be one of the factors that increase the likelihood of arthritis developing. And then if you have nerve damage, we do inject nerves with some of the orthobiologics, and can help improve the likelihood of nerve damage, resolving or patients recovering from that. So we're going to hear from the original founders of the Regenexx.
Doesn't do Regenexx. They've got a simple little bedside machine like this. Take your bone marrow or your blood, you put it in here. All the doctor knows is how to do that. Shut the lid, turn on the on. That's it. Now, obviously, this is one size fits all. Not real complex. The doctor doesn't really know how it works. And the doctor can't customize your sample to what he needs to treat you. So this is the type of processing lab that every Regenexx provider has. Goal is, it's a flexible platform through which they can do different things in regenerative medicine. The little bedside centrifuge, one size fits all, it only does one little thing. Here is where you actually count cells. Now, really don't know how many cells you're injecting. That could be a huge issue if you're doing, let's say, one knee. The doctor may only have enough cells for one knee, but he doesn't know that. And he splits those up in two knees, so the patient gets a suboptimal result. Now at Regenexx, we actually count the cells and we know the dose. Regenexx doctor may have the things that you inject in different areas. Platelet rich plasma at one concentration versus another to put in different points. And a platelet lysate that is just growth factors that might be around nerves or in the epidural space. That's what makes Regenexx different. Not a one size fits all, but a customized solution to what you need. Regenexx is 100% focused on orthopedics because we don't want to be a jack of all trades and master of none. Our laser-like focus allows us to do research in this area to improve what we do and sat the deck in your face. Several years ago, we asked the question, could we get a lot more stem cells than anyone else has ever dreamed of getting out of the same bone marrow cell? Meaning, if we take that bone marrow sample and we throw it in the automated bedside centrifuge that every other doctor has, we'll get a certain number of stem cells. We put our scientific team to work on that issue, and the answer is yes. We can get an awful lot more stem cells out of that same sample than anyone else on earth can get. In fact, that's such a unique process that we filed a patent on that process because it allows us to pick out a second population of stem cells that live in your bone marrow that everyone else right now just throws away. That procedure allows us to get 10 to 20 times the number of stem cells per unit volume out of your bone marrow when compared to smaller automated bedside centrifuges that are used by most doctors. If the processing lab was the part of the operation, this is really the brains of the operation here. This is the research lab. This is where we take the patented Regenexx procedures and we expand them. We make them better. We make sure that there's always a better version out there that you have access to. Regenexx is a patented three-part process. First, we till the soil, then plant the seed, then fertilize. Until the soil, we're trying to prepare the joint or the area for your stem cells. When we plant the seeds, obviously we're placing the stem cells precisely under guidance to that area. Then fertilize, we're just adding in nutrients to make sure that your stem cells can do well in the body. This is where we can measure up to 25 growth factors and cytokines in the synovial fluid of someone's knee. Basically trying to look at the soil inside that knee for our stem cell seed. The reason? Because just like a good farmer, we want to make sure that the environment in there, the fertilizer, for instance, is correct. Now, no one else does that. They just take their stem cell seeds and throw them in there. They don't know if the soil is good, bad, or indifferent. But not at Regenexx. The focus here is to go beyond where everyone else is. No one else is spending the time to do anything like this. That's what makes us so different. Unlike other clinics that are just learning how to do this and how to take a weekend course, we wrote the book on all this. We published more research in this area in peer-reviewed medical journals than any other place on earth. The Interventional Orthopedics Foundation is a 501c3 nonprofit. One of the things they do is to collect data on Regenexx patients so that we can know how the patients are doing long term. We're tracking thousands of stem cell treated patients right now. We're also looking at things like possible side effects or complications, all done through this organization. In addition to state-of-the-art lab facilities, we also have state-of-the-art injection facilities. We offer both high-level ultrasound imaging to guide the needle to a specific spot, And we also offer high-level fluoroscopy or real-time X-ray to make sure we're in other spots that require technology. Often what you'll see in other clinics that are trying to replicate what we've been doing for the last decade or more is a blind injection. What that means is the doctor has no idea where the needle is going. He has some idea that it might be in the right ballpark. But that's a little bit like using GPS to get you into the right neighborhood, but forgetting that the GPS needs to take you to the right street number. In the same way, it's critical that the doctor use guidance and be experienced in doing that to make sure these cells go to the exact right spot. Now, that's not a simple thing that can be learned in a weekend. It's a complex thing that physicians spend a year or two mastering before they get reasonably good at. Again, all of that is part of Orthopedics 2.0, moving patients from invasive surgery to minimally invasive needle-based procedures done with precise guidance.
So we just heard from one of the founders of Regenexx, Dr. Christopher Centeno, as to why it's important for you making a decision to use the right type of physician who has the right training, as well as how we work on research in order to improve what we do and make it better so you can have a better outcome. And so we're able to concentrate more cells than any others in any different ways, as he demonstrated with that simple bedside centrifuge. But we have a full sterile research vented hood in order to ensure that we don't contaminate what we take out from you. At the same time, we ensure that it remains sterile for when we reintroduce it to your body. And not every person needs the same amount of PRP or stem cells or the same concentration. And if you're only using a simple bedside centrifuge, there's no way you can determine what your concentration is. We make it personal and customizable just for you and for what issues you experience and not for anybody else. That means you get exactly what you want, somebody, your age, body, part, condition, and even sex needs as best as possible for the best result. And so Regenexx, as I stated, has been the pioneers of doing stem cells and PRP in America. And then that led to them training physicians, including myself and Dr. Buzanowska, in how we proceed with developing interventional orthopedic stem cell procedures and injections. And so that means we get expertise, we get research, we have data, doctors, and everything is stacked in your favor. We follow every patient that has ever had an injection in our clinic and in any clinic that has been a physician trained in doing interventional orthopedics through Regenexx. And so that creates an entire database of patients with maybe similar problems, shoulders, hips, knees, spine, for you to go and on a website as well as research it yourself. And that means that, you're likely of having a good result from people you know. So there are more than 65 locations around the US, and there's international locations as well. In Georgia, there's only 3 physicians, myself, Dr. Buzanowska, and Dr. Christopher Williams up in Atlanta, Georgia. And so data and registry, there's over 20,000 patients who've had procedures that are currently followed. Now, some people elect not to be followed, but that means that we have the largest database of people who've experienced either some sort of stem cell injection as well as PRP that we can go back and to look at the 3-month results, 6 months, 1 year, and then subsequent years as to how well they're doing. And as previously stated, they published over 45% of the world's literature on this topic. And that means we don't guess what we do, and you don't get surprised. Clinical research. We need clinical research, one, in order to move the envelope to where this at some point will be a covered benefit on commercial plans. And like I said, right now, there's over 6 million people in America whose companies provide this benefit for them. And so if your company provides that, then you will be able to take advantage of it. But research helps push the envelope in that direction. And making the effort to collect the data, and we're transparent with it. I mean, it's not like we're only promoting patients who do extremely well. Everyone who has a Regenexx procedure goes into the database if they so chooses, and those experiences are tabulated. So it's not skewed for only having the people with minimal pathology achieving the best results. So everyone in the database is included as part of our metric. And like I said, it's safe, it's effective, and it's not guesswork. I mean, we're not guessing where we're injecting you. And lab research, again, continues to improve. It's tested, it's proven, and we have scientific rationale for it. And we don't take the words of sales reps. You receive the best possible solution. Image guidance is extremely important because it allows you specificity and precision. If you have a problem in the meniscus, we can't just put stem cells in the joint and expect them to go to the meniscus. You have to use image guidance to ensure that if you're injecting into the anterior cruciate ligament or posterior cruciate ligament or the labrum in the shoulder, it has to be a precise injection. And we know exactly where we're injecting and not in the general area. So that's the difference between success and failure. Because if we're guessing, then we're not being accurate. We want to be accurate from the standpoint of ensuring that we provide you the best likelihood of being a successful outcome. And, Regenexx doctors are trained. I had a fellowship. Dr. Buzanowski had a fellowship. Dr. Williams did his fellowship with Regenexx. And so we were already trained in doing these procedures. And now we're adding a different way to help stimulate healing and improving patients' pain and quality of life. And so the procedures are all done by physicians who have been trained through the Interventional Orthopedics, meaning that we've been trained by somebody who had the fellowship, even trained with the original founders of the company, Dr. Centeno, Dr. Schultz. And you get an expert physician with knowledge, skills, and experience, not somebody who's dabbling in this for the first time, who did a weekend course, and it's their first time trying to employ this, utilize this type of treatment. You get the right doctor to make the right diagnosis, and we can perform the right treatment. And that is the key to your success. And remember, not every patient that comes to us is a candidate for this. Some people are too far gone as far as the destructive nature of their pathology. And we recommend that they actually go ahead and have surgery. And so it's best to see someone sooner than rather later in order to determine whether or not your condition or pathology is to a point where you would likely benefit successfully from the types of treatments and injection interventional orthopedics we offer. Cell source, when we procure or take out harvest stem cells, we do it safely in a sterile environment. We look at the viability, how much of the cells that we actually take out are going to stay alive, because we need them to stay alive in order for you to have a successful outcome, which means that the majority of the cells ensure that you have the best potential number as well as likelihood of cells surviving to help your body heal injured tissues. And we're compliant with the FDA. Stem cell therapy, we're compliant, which means that when we do procedures, we have to follow the letter of the law that the FDA has set, and we do not go afoul of that. And what that means is that you get only your cells, nobody else's cells. Get them alive, and we want to introduce them back to you live, and they're properly dosed. Because we can take stem cells, but if you need a certain number of cells in order to achieve the best result, and we don't count them or get that, then we're not giving you the best opportunity to improve or have your body heal or repair injured tissue or damaged areas. And most research means peace of mind, and you get results for value. Like I said, we talked about harvesting bone marrow. We get the highest dose possible. and we know how to count and look for manipulated cells and receive the maximum dose for you. Dosing matters, right? We don't give adults children doses, and children don't get adult doses. And so when we're look at decades of life, we all have certain concentrations of blood as well as stem cells from PRP standpoint, platelet rich plasma, that we need in order to facilitate healing. And so we get the most optimal doses possible, and we know what your optimal dose is, not just taking a certain amount of volume for everybody and then introducing that, because that is not going to give us the best results. So that means you get the right medicine for the job at the right dose, and that we can treat more than one joint at a time. Meaning that if I'm treating your spine, I'm treating your hip and your knee, I will be able to do all of those at one procedure intervention. We look at a holistic approach when we examine patients. We look at stability, how stable the joint is, articulation, how joints move, the neuromuscular component, how does your nerves and muscles function in a coordinated effort? Is there a muscle atrophy? Are we having some lack of electrical productivity from the nerve, which then forces the muscle to not be able to reach maximal strength? And then we look at symmetry. How does one side compare to the other side for differences? The research is the bait and switch, right? Some clinics, they list their studies, what they've done, but they, have little to do with the procedures they offer. They're looking at studies and they don't correlate with what they're offering, or they have not done any research whatsoever. And I love this little Charlie Brown cartoon here. And so who can you trust? There have been banks of tissue from placentas saying that they're live cells. And here you can see that Utah Core Bank on the left side took their product and intubate it, meaning that we plated it on an agar plate with nutrients for, if there were live cells, for them to feed and nourish and blossom and grow, compared to in the purple stem cells. And so the corded cells here grew nothing at 2 weeks. And if they were alive, it should have been looking more like on the right side, with colonies of stem cells growing. This is another example of Liveon Pure, another umbilical cord product that said they had live cells. But when you look at it, umbilical cord, I don't see any growth there compared to cells that are procured from middle-aged bone marrow patient. And so if you look a little closer, there are no live cells in amniotic stem cell products. It's just not. And so we have to be careful of who we're listening to, and maybe use a little bit of deductive education to see that placenta cells as well as amniotic cells are not live, even though they may be live. So it's a play on words that you're getting a stem cell product. In essence, they were alive at some point, but those things cannot be manufactured in America or dead tissue products. So when you're trying to make a decision of who should you trust to do your PRP, one, you look at discounting a heavy emphasis on finance. That everyone is a candidate, and that it's a cure-all for everything. It is not. Everyone is not a candidate. And then they're offering amniotic-related products and calling them stem cells. Or they're using cord blood and calling it stem cells, which they're not. Or they're talking about using fat. And actually, fat does have the most stem cells in them, but the Food and Drug Administration doesn't allow you to extract those cells. And so if you're using fat as itself, it is not, one, it's illegal to do it as a stem cell procedure. So keep all those things in mind. And how do we differ? First visit, our exams are taking 1 hour. If you're a candidate and we're going to draw blood, we may do that the same day or the day before. And then we do a rehab if necessary. and subsequent follow-up visits. So we look at, we don't spend 10 minutes with you and say you're a candidate. We're going to spend about a whole hour and likely perform some sort of diagnostic ultrasound on a joint that area you may have a problem with in order to go over some things to give you a better understanding, one, of your pathology, and then where we see we may be able to help. And that may require you getting more in-depth imaging, such as MRI. So for stem cell procedures, same thing. Initial visit lasts an hour. And as Dr. Centeno said, the first day we till the soil, the second day we plant the seed, and then we fertilize. And which means that you may have some pre-injections to get the joint or tissue ready to accept the stem cells. Day 2, we actually harvest the cells and reintroduce them back into you on the same day. And that's followed by a procedure to help feed the cells, or, when we fertilize, we're feeding cells. So, or in the analogy of a farmer, we're feeding plants or seeds. And of course, there is rehab. And we have subsequent follow-up visits. So, most of the rehab, 60% less time than surgery because it's a faster healing process. The gynecology is a form of therapy in which we look at movements and symmetry. And then some people end up doing it themselves if they're pretty motivated and have a pretty extensive history of use of therapy in gym services, as well as being athletes. And so who is this, who is this recommended for? Who would be a candidate? People who, one, want to avoid surgery. People who say, I want to keep all my parts. I don't want to have anything removed unless it's absolutely necessary. People don't have time to slow down. Or go through a long rehab. And you don't want to take any medicines, or you have failed surgery before and you're dissuaded from having more surgery. Someone who had surgery and had a bad outcome. That definitely can influence how we think about having surgery when we see loved ones or friends have similar problems or conditions, and that results in bad outcomes. Or we have medical contraindications. Some people are just too young for surgery. And so, with Regenexx, our procedures typically result in less pain, give you more function, can improve your mood because you're less cranky when you're feeling better. Be able to reduce the use of medications to kind of use as a Band-Aid for the pain, and then get you, back to your preferred and active lifestyle. And so here is just a few last slides before we get into the Q&A. This is some procedures I did back in 2019 in reference to doing an ultrasound guided injection of a needle going into the patella tendon for somebody who had patella tendonitis and arthritis. And so the patella tendon is here to there, and you can kind of see my needle accurately being placed in the tendon and injecting it, and not guessing where I actually put the needle. So, and here's one patient that had Regenexx back in 2019 who had cervical as well as lumbar problems. On the left screen, you can see that this is the neck, that's the jawline, and I was doing what we call a transforaminal epidural injection using growth factors. And we subsequently moved down to the lower back, and you can see that the patient has a fusion lumbar spine. This is a posterior fusion here, and then they also had an anterior fusion. The patient was suffering from severe leg pains on both sides. And so what I performed was 4 injections to target 4 nerves, 2 on each side of the body. And you see the needles. And then we subsequently put in platelet lysates to help reduce and help repair. One, reduce pain, and then help repair some of the particular symptoms of pain that's radiating down the legs. And this slide over here is a needle going into the sacroiliac joint of the same patient. And so we treated multiple conditions at the same time with this patient, and that was using platelet-rich plasma, or PRP. Here is imagery of me doing using fluoroscopy for spinal injections in a patient, in which instead of using steroids, I'm using either platelet-rich plasma or platelet lysates. This is an ultrasound guided procedure of me injecting, well, the right side is me aspirating some inflammatory fluids out of the knee, and the left side is me actually injecting into the joint platelet-rich plasma. Here's some other images of the needle here into the joint, as well as aspirating a fluid, which looks darker anechoic. And on the right side, we can see that we do this for carpal tunnel. This is a patient who has some carpal tunnel, and the needle is sort of inferior to the nerve, and we injected or hydrodissected that to alleviate the patient's pain. This is an image of me procuring bone marrow from a patient back in 2019. And our technique is now changed to where we're fully gowned, but this is the patient is all draped and sterile, and this was done using ultrasound guidance. And this is a patient who we did an interosseous injection from a lateral approach, where I came out from the side of the hip all the way near to where the patient was experiencing some sort of cyst within the bone. So we guided this long trocar needle to where the problem was on the MRI, and injected stem cells into the area, as well as into the labrum and into the joint space. All right, and so these are some more images. And this is how, we process some of the biologics from patients. So once, this is what the finished product looks like on a tray before an injection, so where we have some platelet lysates, something for prolotherapy, as well as some SCP and more platelet lysates. So we do it under a hood, in which is sterile with forced air up, positive pressure air, to prevent any sort of bacteria from coming across on the exterior of the vented hood into the interior where the sterile biologics are. And, it is pretty safe, very safe. And so, as I've said before, that there are over 6 million lives of people who have Regenexx as an option because their companies themselves have gone ahead and saw the benefit of Regenexx from, one, less time off work, number two, a faster recovery, and being, faster return. So the companies are looking at this, one, because it's a less expensive option than surgery, but it's providing results, faster recovering, healing times for patients to keep these companies profitable. And so how does this stack up from a cost standpoint? So when we look at prolotherapy, is, when we inject some sort of agent into ligaments to create tightening for stability purposes, that typically runs between $300 and $650. PRP in the joints can run between $1,000 and $1,500, whereas within the spine, those treatments are $2,000 to $4,000, and then stem cells are anywhere between $5,000 to $8,000. And know that this would include multiple areas, just unless you're just a patient who has just one area. And so we don't look at, if you have a hip problem, a knee problem, a spine problem, doing all those separately. We would try to combine everything and do it all at one time. And now we're to your questions. So first, thank you for spending some of your time on Valentine's Day with me. And I hope, one, this was educational, and two, you sort of look at alternative options if you're experiencing musculoskeletal problems with your spine, your hips, your knees, ankles, elbows, fingers, as well as toes, that there are ways to help mitigate your pain and get you back into functioning and enjoying life again. And this has been something that has been utilized since 2005. So it's not something that is off the shelf, off the cuff, that is, brand new. It's a de novo practice in the way we conceptualize and think about how we manage pain in areas, but it's been out since 2005. And once again, thank you for spending some of your time with me today. And if you would like to schedule an appointment, I'll leave this up on the screen. You can contact our nurse, Jessica Brady, at the email or via the cell phone, and she can get you more information or look at setting you up to come and have discussion with us to find out if you are a candidate for Regenexx procedures. And there's a question, is that when we're doing our procedures, is local anesthetic used only, or is it moderate sedation used as well? And the answer to that question is we use local anesthesia for everything. And in some patients who like moderate sedation, we use that as well. We typically use moderate sedation for bone marrow harvesting. One, because it's much easier, patients awake with no pain. And if the procedure requires us to do something such as we're going to inject into a disc or we're going to inject into the bone, we absolutely will use moderate sedation. For other injections, such as if it's a simple spine or a peripheral joint that doesn't require any bone injection, it's going to be based upon the patient's tolerance that they know themselves prior to us agreeing upon a procedure. But we do offer both as options. And thank you for the question. All right, well, thanks for participating. This video will be edited and then available on the website. So if you want to watch it again, we will be having monthly seminars. Some of them may cover general topics, as well as us going more specifically to certain areas of specific areas of the body. We have another question. And that question is, if you have several areas, will you offer sedation? Absolutely. We'll offer sedation because, one, we want this to be a good experience. Even though if you're getting multiple injections, it still needs to be one comfortable for you, because that makes our lives a little easier when we perform these procedures. So yes. All right. So once again, this will be available soon on our website. It may be also on our YouTube page also. Another question that came in said, can you use recent MRI, CT scans, or would you like to get further images? So we like to use recent imaging, especially if the condition, one, has progressed. The imaging that you may have is over a year or 12 months, and there may be some further progression of the pathology. And so we like to get a little bit more recent imaging. If the imaging is close to a year old and there hasn't been significant changes, we likely would do x-rays and maybe look at ultrasound images that we do to make a decision. And so the best and most recent imaging is always the most information to help us make the best decision and recommending which treatment would be the best for you, as well as you seeing how your pathology has changed or modified over the course of time. Another question is, payment due before the procedure? Typically, yes. And if individuals want to discuss other options, we turn them over to our billing department. And are there any other questions at this time? All right, once again, no. Okay. Another question. One of the individuals is describing a condition in which there's tendonitis but no tears, and would the procedure help? So in general, the joints that have shown the best results are shoulders, and Regenexx or PRP was initially demonstrated to show best results when patients have tendonitis or tendinopathy. So absolutely, if there are no tears, and this is all that is causing the problems that you have, you would likely be, from what you're describing, a very good candidate. There are other things we look at too. We look at comorbidities, if there are any ongoing health issues, medications that may have to be discontinued, those sorts of things. And so, but basically from a tendonitis problem, those are historically responded very well to using just platelet-rich plasma. It's not a condition in which we would recommend any stem cells at all. Most patients respond very well to just platelet-rich plasma. All right, thank you all once again for coming and joining us, and we will have, as I say, monthly discussions about Regenexx, and hopefully we can help you, one, eliminate your pain, two, get back to living the life that you want to live. All right, everyone, take care, and we look forward to seeing you again.